Hi, and welcome to Life, Death, and the Space Between podcast. I'm your host, Dr. Amy Robbins, and I'm a licensed clinical psychologist and medium. And here we explore life, death, consciousness, and what it all means. Today, I have Julie Ryan on the show. Psychic and medical intuitive, she can sense what medical conditions and illnesses a person has and facilitate energetic healings. She can communicate with spirits both alive and dead. Julie can scan animals, access people's past lives, and remove ghosts from homes and other buildings, and she can tell how close to death someone is. Her book, Angelic Attendants, What Really Happens as We Transition from This Life into the Next, describes a series of events that involve angels, multitudes of deceased family and friends, the spirits of deceased pests, and countless serendipitous and miraculous moments. Each week, Julie scans callers on her podcast, Ask Julie Ryan, which is heard by millions in over 100 countries throughout the world. Julie is a businesswoman, inventor, author, podcaster, and serial entrepreneur. Her surgical device inventions are sold globally, and she has founded 9 companies in 5 different industries. Julie's psychic and medical intuitive skills are learned. Welcome, Julie.
Thanks, Amy. I'm thrilled to be here with you.
I'm thrilled that you're here. There's questions in just that bio that I'm curious about, but
yeah, sure.
we're gonna dig into the medical intuitive part, and then if we have time at the end, I'll ask some questions about that. Okay. But can you speak to us about what exactly is a medical intuitive?
Sure, absolutely. I am able to raise my vibrational level, Amy, to the level of spirit, because we're all spirits attached to a body having a human experience. And when we're attached to a body, we vibrate more slowly simply because the body has mass. So it slows down. It would be like sending an electrical current through Jell-O. It's not going to be as fast as it's going to be just in the air or in a wire, if you will. So what I do is I've learned to turn my abilities on and off at will, and I raise my vibrational level to the level of spirit, and I'm able to connect with anybody anywhere in the world. And then once I'm connected to them, I have a hologram of them in my mind's eye. And I envision shooting energy from their feet up through the top of their head, and it's as if I'm looking at an MRI or a CT scan or an X-ray. And I can identify medical conditions like broken bones, torn ligaments, viral infections, bacterial infections. I just had finished an appointment with a woman who has breast cancer. She didn't know it. I mean, I could see it. Little teeny tiny sacks of cells that we removed. So things will be identified, and then there'll be some type of an energetic healing that happens. And for me, that healing can take the shape of something getting removed, like with this woman. There were 4 little pockets of cancer cells that I got removed in an energetic healing. And something can be removed, something can be added. I watch healings happen all the time that emulate what I saw in the operating room and in other departments of the hospitals for my 35-year career in the surgical device industry. As you mentioned, I'm an inventor of surgical devices, so I was in and out of the operating room for decades. And I watch actual procedures energetically that emulate what I saw in operating rooms. And then sometimes, Amy, I see procedures, energetic healings happen that utilize devices and methodologies that I don't believe have been invented yet. And that's fun when I see those, because that appeals to my inventor brain.
So take me back to what that looks like, both the actual scan when you do the scan and sort of what you see, and then also how you emulate the process of the healing energetically. And would this woman that you're talking about seek out treatment? Or is it sort of too early for it even to be detected by any sort of mammogram or ultrasound?
When I see cancer cells in somebody, especially when they're in clumps, like in this case in her breast, both breasts, she had some, and they were being caused by her underwire bra. She had large breasts, and as she said, very dense. And in an underwire bra where the wire starts on the side and then goes down in a U and comes up in the middle, she had clusters of cells in both of those places where the wire started because it was causing pressure on that breast tissue. On both breasts, same thing. So I watched those pockets of cells get removed, and it's like I'm watching a movie in my head, a little mini movie, and I watched them whenever cancer is involved, cancer cells, I watch them get encapsulated in a membrane. Like if you were going to put something in a Ziploc bag and seal it to remove it. And the reason why I always do that is I don't want those cells going anywhere. There's lots of schools of thought about surgery for cancer, even biopsies, that it gets those cells on the move in the bloodstream. And I've heard oncologists, I heard an oncologist a couple weeks ago say that she thinks biopsies are going to be a thing of the past here in the next 10 years because of that. So it's not like I'm doing it, I'm the conduit. It's my spirit guides, the person with whom I'm working, their spirit guides, their angels, deceased loved ones, whoever. It's like I'm watching this little mini movie and I'm watching the procedure happen in warp speed. If I had a camera and I panned out and I got a wider view, I would see spirits working. But they're working through me. I believe that it's spirit working through me for these healings. And when healings happen, they always are prevalent on the energy field, on the energetic plane. And then it's up to the body to catch up with them. It's the body and the spirit's prerogative what they do with it. So in her case, I always encourage somebody in that situation to go get a scan. I would say, go see your doctor, go get a thermogram or something like that. I prefer thermography to mammography, just from what I've read. Less false positives. And it can show up immediately. They may not find anything, which would be perfect. That would be the optimal. It may take days, weeks, months for the body to catch up with the energetic healing. It may involve some type of medical intervention, like she may need to have a lumpectomy or something like that, if that happens. And then there's also the possibility of that the healing doesn't manifest in the physical body because it's not what the spirit has intended for that experience in this lifetime. And so certainly I am the facilitator, I'm the conduit. It's up to that person's body and their spirit and whatever their life path's trajectory is to do what they will with the healing. That's pretty rare that it's not implemented. It's pretty rare. But
so there's the physical body and then what you see as the energetic body. I've heard that there's multiple sort of realms of our.
Right. They're called layers of the energy field. Is what I was taught. So the best analogy I've come up with is that the spirit and the body, everything's pure energy. I'm sitting at a big cherry desk in my office and it feels very solid, but I know that it's energy that's vibrating slowly. Same with you. You're sitting at a desk, obviously, and the energy is vibrating slowly. So like I said before, spirit vibrates faster because it doesn't have the density of the body. And I was taught as a kid in religious training that the spirit is someplace in the chest area, like the sternum almost. That's not what I perceive, Amy. What I perceive is that the body's inside the spirit. And that's why if you look at a painting or a depiction of a religious figure, oftentimes they're shown with a halo around their head or sometimes around their whole body. And we, at this point, we just think, oh, that's a holy person, that's a saint, or it's an angel, or it's whomever. Well, that's just their energy field. It's their aura. We all have that. We're all holy people. We're all made in the image and likeness of God. So the spirit is the main everlasting part of us. The body goes inside the spirit. The spirit is the power source for the body, which is why when somebody dies and their spirit and their body separate, the body doesn't work anymore because it doesn't have a power source. So the best analogy I've come up with for this so far is imagine going to the pet store and buying a goldfish. Like you're taking your little boy to the pet store to buy a goldfish.
We have one beta. I don't need any more.
Okay, there you go. They're going to put the fish in a plastic bag of water in order for you to get it home. So if you have a picture of that goldfish in a bag of water, the goldfish represents our body, the water represents our spirit, because the body's inside the spirit, and the plastic bag represents the energy field membrane, and that's the container that the body and the spirit are in. Because energy...
That's such a different way of thinking about it. I've never thought about it that way.
I know, but if you think about energy being used for a specific purpose, like powering the body, energy, electricity comes into our homes in wires. It's contained in wires, natural gas in pipes, water in pipes, same kind of thing, same concept. And whenever somebody has a medical condition going on, there's always a tear or a hole in that energy field membrane, as I perceive it. And that tear or hole, and you'll love this, being a psychologist, is caused by some kind of emotional event, either in this lifetime or a past lifetime. And so in order to heal that tear or hole, all I need to do is illuminate it. I envision myself going into that tear or hole, and I'm shown some kind of a scene. And I'll be given what the year was, a little bit about what happened, if it's this lifetime. If it's a past lifetime, like this woman that I saw, that she had little clumps of breast cancer cells. It was a past life thing in 1947. And it's so wild, especially the past life stuff. In 1947, she was born, I think she said in 52, but in 47, she was a telephone operator, a switchboard operator at the University of Wisconsin in Madison. We got her name. We got that she was in charge of the switchboard that programmed, or it didn't program. You remember the old switchboards where they put a plug in? I saw this little mini movie of her doing this, and it was to the administration building. And we got the person's name, and so I told her, I said, go Google it. Google all those different variables, all those different parameters we got, and see if anything comes up. Oftentimes, we'll be able to corroborate the information we get from past life with online. Wow. It's wild. So anyways, once we illuminate it, it heals that energetic membrane, the energy field membrane, and the body can work on full power. Because when there's a leak, the body's not working on full power, and it always precedes any kind of disease or illness. So let me finish one quick thought. If I go back to the fish example, that bag that fish is swimming around in, if it has a pinhole in it and the water's draining out a drop at a time, for a long time, that fish is going to be okay. But when enough water drains out, that fish is going to be in trouble. And that's the same thing that happens with the human body. So we fix all of that. It's fascinating.
So you scan the body, right, and you see where there is disease, anything that's not
broken bones, torn ligaments, GI issues,
and all of that issues. Stuff looks different to you, like how you see it in your mind's eye looks different. Like a broken bone looks different than a cancer, looks different than a torn ligament.
Like a broken bone on an X-ray. I mean, my friends, now we're old enough that a lot of us have grandchildren, and I'll get, I've worked on my friends' kids throughout the years, and they'd say, I'm on the way to the emergency room with Johnny. He fell up the swing set, look and see, does he have a broken arm? And I'll say, yeah, it's broken above his elbow, on his right arm. And they'll go in, and the moms will usually say, yeah, I think Johnny's got a broken elbow, or his arm's broken right above his elbow on his right arm. And the docs and the techs will look at them like they're nuts, but then the x-ray will come back and it will be exactly where I told them it is, because I'm looking at an x-ray in my mind's eye. Same thing with cancer, same thing with torn ligaments, viral infections, bacterial infections, scar tissue, organ issues. It's fascinating. It's fascinating. And I believe the reason I was in the medical supply industry and in and out of hospitals and, developing products and stuff for all those decades is so that I would know what I'm seeing in my head now at this point when I'm doing scans on people.
So why do people seek you out? Do people seek you out preventatively or typically more reactively once something's been an issue?
Normally it's because they've had symptoms and they've been to multiple doctors and gotten multiple diagnoses and multiple treatment plans, and none of them have worked. And so they're calling me and saying, can you help? I've got this going on. And oftentimes it's something simple that all these fancy schmancy tests and stuff are missing. Or it's something, for instance, I was talking with a woman who's a Broadway star. She's a Broadway star, has been in multiple Tony Award winning productions. And she has had an issue with her ankle. She's had 2 surgeries. She dances and sings and she's in musicals. And I watched what had happened with the surgery. One of the surgeries had been botched. And so we regenerated her ankle, and I just got an email from her this morning. We did the healing on her, I think it was Wednesday or Thursday of last week, and she said, oh my God, I'm able to move unlike I've been able to move in 15 years. She said, I did yoga this morning, and I was able to do a downward dog and put that foot all the way down for the first time in 15 years.
So she has the surgeries, and you go back and watch the surgery and what happened?
She had the surgery, and I could see where the scar tissue had formed around the surgeries that she'd had that was stopping her ankle from being mobile. So she'd had 2 surgeries years ago, and she'd go to the doctors, and the doctors would say, hey, your ankle looks fine. And she's saying, well, it may look fine, but it's not working right. And so she came to me. And I said, you got a bunch of scar tissue around that ankle that's restricting the movement. So I watched an energetic procedure where that scar tissue was removed. And within short order, she's able to move her ankle and it's healing.
I got it now. So you watch the procedure energetically, just like if it was a surgery that someone was doing.
Exactly.
So you would call in angels, guides, loved ones to perform this?
Don't even do it at this point. I've been doing it for over 25 years. It's like driving a car. When you've been driving a car for a long time, you can think, okay, I have to put the key in the car.
I haven't. I'm like 18.
Okay. And then you have to put your seatbelt on, and then I have to gear shift. You just do it. And so that's where I am at this stage. But I know that it's my spirit guides, the person with whom I'm working, spirit guides. It's God, it's the universe, it's, all these entities. It's interesting, though, when I'm scanning somebody who's in surgery or doing an instant replay of a surgery that has happened, the person who is the patient who's on the OR table, their guardian angel is always floating over the head of anesthesia. And there are surgeon spirits that are advising the actual surgeons doing that procedure. So I can tell real time how many actual physical surgeons are in there. I can tell you what they're doing in that procedure, where they are in that case. I can read the anesthesia equipment. I can tell you who the deceased loved ones of the patient who's being operated on. There are always deceased loved ones that are in the room for support. It's just phenomenal, the stuff that we're able to see.
Are there always guides and angels helping the surgeons?
What I normally see is I'll see a surgeon's spirit over the head of the actual surgeon. So for instance, if there are 3 surgeons in the room, they'll each have their own surgeon spirit guide that's guiding them and advising them during that procedure.
So what happens when things go wrong?
They're probably not even aware of it. Well, they're helping guide them. When things go wrong, you mean if somebody's dying?
Or in surgery, when there's a mess up or the surgeon does something that causes, someone to bleed out or, cuts off the wrong leg, things along those lines.
Yeah. That's funny that you say that, because there's a huge problem in surgeries where they'll operate on the wrong limb or the wrong leg. That's when they mark it with a purple marker.
Right. No, I know.
And they'll ask you 5 times, okay, now what are we doing today? What's the surgery? Yeah, that's a huge problem, at least in America. There's a broader perspective of what we judge as something going wrong, because everything is perfect how it unfolds in our lives. So something that we would perceive goes wrong, for instance, you used the example of somebody bleeding out in surgery. That is the surgeon's path, that he's experiencing, it's also the patient's path that they're experiencing. And then that goes into that cell, that spirit, and their prerogative of what they want to experience in this lifetime. So it's all interconnected and playing together. We in our human minds have a tough time of saying, well, how can something like that be good? But we don't have the capacity in our human minds to be able to envision all of the outcomes and all of the benefits that can come from a situation. There are too many variables. So all we can do is trust that it is that spirit's trajectory, and it is that spirit and all the spirits involved, and the people, the humans involved, that they're expanding in ways that are benefiting all of them, even if we don't understand it in our human minds. Does that make sense?
It makes perfect sense to me. I think, as much as I've done this work, I still grapple with those feelings as a human being of what it means when, someone were to bleed out. And I understand from a spiritual perspective, or any sort of death, right? I understand from a spiritual perspective the concept of soul contracts and growth and the immortal soul, and how we are, this is not just about this lifetime right now, but what our soul's path is to learn and explore.
Right.
And I still am human, and like everybody else, am less fearful, but certainly, think about if something happened to my children or my husband and the human pain that would cause. So I'm always kind of trying to straddle both those worlds, and it does become really, I think, about trusting that it is in your highest and best good. And yet when you're in the midst of human psychological pain, I think that's really hard.
I agree. Nobody said it was easy.
Right.
But I also believe that we humans have judgment and spirit doesn't. So to spirit, it's just an experience, whether somebody has surgery and it's very successful or they die on the table in the OR. To spirit, it's just an experience. To those of us that are human, we see something as really good and something else as horrific. Certainly.
Right.
Yeah, and that's part of the human experience. That in heaven, what I have gotten from spirit guides and doing this work for decades is that everything's pure bliss there. I mean, they think it and they have it. They don't really go through the creation thing. And I keep being told even the most horrific things that we perceive as being awful, they just see it as an experience.
And for everybody.
Yeah.
Human.
No, it's just an experience for that spirit.
Right. And for the spirits of the people who experience it as
horrific,
painful,
exactly.
And horrific.
Yeah, exactly.
So with this like healing procedure, do you feel like everybody who has like a cancer or broken bone or torn ligament or Lyme's disease or whatever it is should have an energetic healing in addition to the physical healing? Like, do they kind of go hand in hand, and are you missing a piece if you don't have both?
Great question. I have never been asked that in all these years. So
I love asking questions that other people
score.
Thank you.
Yeah. Great question. I don't think there's any should in anything, because whose opinion is should, first of all. I believe that the people who get energetic healings because they're seeking them, that's part of their spirit's path to explore that. Certainly there are most of our Western society, Western civilization, especially my parents and my grandparents. Maybe you're a lot younger than I am, but
18.
Yeah, 18 again, right. Child prodigy here.
Right, exactly.
The psychology Doogie Howser, right? Email form. I know my parents and my grandparents, if doctor said it, they just did it. They didn't question it. I mean, it was just boom. Whereas we have so much access to information online and through other sources that I always encourage people to be really well educated on what's going on and to have an intelligent conversation with their doctor. And some doctors get their egos poked when somebody doesn't do what they tell them to do. They get upset about it. And that's their stuff. That's that doctor's stuff. The doctor is there to serve the patient who is the customer. And so I think insurance has really made the doctor-patient relationship, it's really altered it just because they don't have enough time. Because they've got to get so many patients in order to get enough money to keep everything afloat and all of that. I think the model has changed dramatically.
Yeah.
But I think that certainly people who say to me, well, I just don't believe in this stuff. I said, well, I'm a skeptic. I'll say, well, that's appropriate. And they'll say, well, you got to prove it to me. And I'll say, well, no, really, I don't. It's not for you, obviously. It's for people that want to explore this and want to experience it. And obviously it's not for you. And then usually they'll back off, and a lot of times they'll say, well, okay, scan me. You know, they're afraid. They're afraid of what they don't know. Right. They've been inundated throughout the millennia with evil spirits and, you know, all this nonsense that has been concocted, in my opinion, by cultures and religions to control the masses.
And to provoke fear.
Yeah, what better way to control people than through fear? But what I find is that all spirits are pure love and light. And people say, well, don't tell me if you see something bad. And I say, well, I don't edit anything, number one. And number two, everything can be healed. So why not?
So what's the difference between what you do and like a Reiki healing?
A Reiki healing is similar to what I do. I started off with Reiki 35 years ago, probably. And it has evolved over that time into how I do it. So it's just different. It would be like, the way a painter paints with oil in his studio is different from somebody else painting with oil in their studio. It's just different techniques, personal things, that kind of thing. I don't find too many people that see, there's a very well-known doctor named Christiane Northrup. I call her the fairy godmother of women's health. She tells people that I'm a human MRI. So the way that I do it is based on what my experience is, what my training is. I went to training for 6 years, formalized training to learn how to do this. I think I have spent the equivalent of a medical school degree cost to get to this place and over all of these years. But it's how I do it. It's different from how somebody else is going to do it.
Just like any doctor is going to add a little of their own
nuance
way of doing things after years of doing it.
Not only that, and based on their education and based on
training
and what their concept is of how they came to even be interested in this and what was their upbringing. And for instance, people who believe in evil spirits and the devil and curses and things like that. Well, okay, I was brought up in a religion that talked about those kinds of things, but I don't believe it. But certainly it formed something that I could contrast against in this spiritual work that I'm doing now. And it's just, I think all of those variables come into play. Does that answer your question?
So I think so. So one last question before we wrap up today, which is, your skills were learned.
Yes, absolutely.
And I think that a lot of people feel like if they don't, people call it a gift. You have a gift for doing this.
Right.
But some people, I think, do come to it and it's very natural to them, just like anything is, right? Like there are some people who are very natural artists, musicians, and other people who learn it. So can you just tell us a little bit about, you mentioned it before, but what your process
Sure. I think we're all born with the ability, we're all clear channels to the divine, and anything is possible, and we hold ourselves back with limiting beliefs that are false.
And our mind, right? Like our children are so much clearer channels, and then you see around, 5 or 6, it's almost like the whole kind of closes up and the ability to access that, our soul.
Right. And we're conditioned out of it. And exactly that's what I see, Amy, exactly what you described. The filters start to get in place for kids about the age of 5 or 6. There's a lot of little kids that remember past life stuff. And then once they get to be 5 or 6, then they don't anymore. And a lot of it's socialization. Well, honey, that's just your imagination. That didn't really happen, kind of a thing. So they learn to shut it down. But everybody is born with the ability. Certainly all of us have had situations where we think of somebody and we either get a phone call from them shortly thereafter, or we run into them and we say, oh, serendipity, or what a coincidence, or whatever. No coincidences in life. You were thinking of them. You were having a psychic connection with them, that you were going to run into them. So certainly we're all born with it. I have enhanced mine because I'm interested in it and because I've done some training and come up with methodologies to utilize it. And I do it every day with somebody, either with scheduled appointments or for family or friends or whomever. And so my son, if he's watching a football game for his college and somebody gets hurt, he's texting me going, Mom, what's wrong with them? Can you or whatever, which is hilarious.
Well, I mean, I'm not even going to touch that because I know what team you cheer for.
That's right. That's right. Yeah.
Although maybe now that I have your cell phone number, I'll start texting you.
That's right.
For my team.
So everybody, Amy went to Michigan and I went to the Ohio State University.
Right.
So that's what we're laughing about. But he went to Alabama. So he.
Okay. Then he can keep texting you. I don't need to.
Roll Tide. Yeah. Funny. So back to your question, I think we all have the ability. And let's talk about football. Everybody can throw a football. Some people are better at throwing a football than others. Do they have some innate talent? Certainly. Do they work on it for decades to get to be an NFL player? Certainly. That's what I've
like Tom Brady, who went to Michigan.
Exactly. Yeah, and he was a nobody at Michigan when he got there.
Right? Yeah. I don't even know how much he didn't play all that much.
And nobody when he got drafted, and look at him. Anything is possible. How fabulous is that?
So if people are interested in what you do, where can they find you?
AskJulieRyan.com. Everything's at AskJulieRyan.com.
And you also do a radio show. It's on Thursday nights. And I'm going to be on your radio show talking about what we talked about, I guess. Or maybe you'll scan me.
Yeah.
Maybe I'll have a health question for you.
Yeah. That'll be great. Yes, we tape it on Thursday nights at 8 Eastern. And people call in from all over and they ask Julie Ryan. They ask me a question about health, or about their medical question, or they ask me about their pets, or they want to talk to their dead grandma. They want to talk about a past life thing, spirit guides. They have a loved one who's dying. Can you tell me what phase the person is dying? How close to death are they? Can you communicate with my dying mom or sister or whomever? I do that often when someone is dying and the family needs to get information, like what are their wishes? Do they have a will? Where can we find this? Where's the safety deposit box? What bank do they use? That kind of stuff. And it's amazing the information that we can glean from whoever the person is dying that's unable to communicate. Because I communicate with them telepathically, and that's how spirits communicate.
And we're going to do another show on transitioning, which I'm excited about
Yeah.
as well. So, well, thank you so much for your time today. All your information will also be in my show notes for people to find you for whatever they need.
Perfect. Thanks for having me. What a treat.
Thank you for being here.
You bet.
Like what you heard today and want to hear more? Curious about what comes next and what it all means? You can subscribe on iTunes. Just go to podcasts and find Life, Death, and the Space Between and hit subscribe. And you can follow me on Twitter and Instagram at Dr. Amy Robbins. Ask me any questions you might have, let me know what else you'd love to hear about, or just share your story. I can't wait to hear from you.